Assalamu alaikum everyone. Good evening. This is Farzana, Managing Director, International Medical Information Center. As you already know that today our topic of discussion is breast cancer and its treatment options. Breast cancer became very alarming for the women in the world and in Bangladesh, especially during this pandemic situation. According to the National Cancer Institute projects that pandemic-related delays in diagnosis and treatment disruption could result in 10,000 additional deaths from breast cancer and colorectal cancer over the next 10 years. In addition, researchers report that during the first 3 months of the COVID-19 pandemic, diagnostic and screening mammogram have decreased over 80%. There has been a 50% decline in visits to primary care physicians. All this plus disruption in diagnostic tests, lab work, and delayed appointments are all likely to have an impact on cancer patients. So as part of National Breast Cancer Awareness Month, it is time to encourage women to get checked, make healthy choices, and take care of their breast health. As part of IMIC initiatives, this webinar is brought to you by International Medical Information Center and Farrer Park Hospital, Singapore, along with Blue Sky Charitable Foundation. Our motive is let's defeat breast cancer. We are strong together. So to discuss on this topic, we have a panel of experts from Singapore and from Bangladesh. Let me introduce with you the panel of experts, and we are extremely honored with the presence of the experts. First, I'd like to introduce you to Professor Dr. Qamruzzaman Chowdhury, Director Medical Affairs and Head, Department of Radiation and Oncology, Asian Mission Cancer and General Hospital, and advisor, the Blue Sky Charitable Foundation. Thank you so much, sir, for joining with us.
Thank you for giving me a chance to attend as a panel discussions in these programs, these nice programs.
Thank you, sir. So we have Dr. Melanie Seah, Senior Consultant Breast Surgery, Farrer Park Hospital, Singapore. Let me brief you a little bit about her. She had her medical training at the National University Hospital of Singapore in 1995, followed by residency training in general surgery at Tangkoksan Hospital. She also had her fellow in general surgery at the Royal College of Surgeons of Edinburgh. After her fellowship training, Dr. Seah was awarded the Health Manpower Development Plan Scholarship by the Ministry of Health for further clinical skills in breast orthoplastic surgery at Marian Hospital, Germany. Thank you, Dr. Melanie, for joining with us. Thank you.
Thank you, Farzana.
We have Dr. Lynette, Senior Consultant, Medical Oncology, Farrer Park Hospital, Singapore. Our areas of interest include breast and gynecologic cancer, hereditary cancer, genetic counseling, psychosocial oncology, palliative medicine, as well as general medical oncology. After graduating from the National University of Singapore in 1996, he pursued a master's degree in internal medicine and obtained her membership of the Royal College of Physicians in UK 2000. Thank you, Dr. Lynette, for joining with us as well.
Thank you for the kind introduction. It's a pleasure to be here.
We have with us, we're extremely honored with the presence of Ms. Ayesha Shelley, Additional Commissioner, Tax and Head Advisor, the Blue Sky Charitable Foundation. She is a Bangladesh government official, diplomat, author, social activist, and previously she has been working as a consular labor in Bangladesh High Commission, Singapore. And especially she's a cancer survivor. So thank you, madam, for joining with us, and we'll be happy to hear from you.
I am honored and delighted to be part of that webinar. Let's beat cancer.
Yes.
Thank you.
Definitely. Thank you. So First, I'd like to hear from Professor Qamruzzaman Chowdhury, sir, as you are one of the pioneer doctors from Bangladesh, and you are researching on cancer and lots of patients. Whenever any patient suffers from cancer, first name comes from our patients that we need to go to Dr. Qamruzzaman, sir, to ensure if everything is okay. So right now, so what is the condition of cancer situation in Bangladesh, especially during this corona situation? How you are managing patients, and especially I'd like to hear from you the how to control this breast cancer according to your experiences from last few years. Please, sir.
Okay, okay. Thank you, Farzana.
Thank you.
Especially Dr. Melanie and Dr. Go doesn't know about the situations in Bangladesh. Bangladesh has a 160 million populations, and we have near about 22 cancer centers for the total population. So very small amount of cancer centers to beat this cancer management, especially in the countries. And we had a one national cancer institute that is it's a government one, and two comprehensive cancer centers by the private sectors, and a lot of lot of hospitals has the cancer departments. So total near about 22 cancer centers that have all the facilities. And regarding the manpower in Bangladesh, we had a surgical oncologists, not that much, but we had a lot of surgeons that can do the surgery. So surgeon is not inadequate in our countries. But regarding the medical oncology, we had only 16 medical oncologists, postgraduate medical oncologists doing the medical oncology service in the Bangladesh, and near about 160 to 200 radiation oncologists they are serving in the countries. So if you see the scenarios in Bangladesh, according to the cancer situations, it's a very small centers to give treatments to all the patients. So and when we see the 10 years data from the national cancer centers, we see in the case of breast cancer, we see a lot of patients are coming in the advanced stages of the disease. So early stages are very small amounts. It's due to actually patient doesn't have the lot of experience regarding the screening and other things which should be carried out to detect the disease earlier. So in that cases, we are very lacking in that cases. So awareness is very important. If you see the 35 years data from the Seah study, surveillance epidemiology end results from USA, you can see the breast cancer is declining, usually due to screening and also early detections and modern technology. But that is we are not having that facilities here because we don't have the screening facilities here, and the patient doesn't have the knowledge, especially to come to the physicians or come to the centers where they can have the early detections and treatments. So in that cases, we are lacking. And during the COVID periods, what we happen actually, usually patients are comes in the advanced stages, but due to the COVID situations, nobody came to the tertiary hospitals or even the district hospitals. Yeah, in Singapore, you can see Singapore is just like the total country is just like the Dhaka cities, the capital of Bangladesh. But Bangladesh is very bigger. I mean, it's bigger than the Singapore. And a lot of patients are residing near about 200 to 300 kilometers from the centers. And we had a divisional or district levels where the facilities are there, like medical college and district hospitals. But people reside in a remote village. They cannot come to the centers for having treatments or detections. So during COVID periods, a lot of patients actually didn't attend the hospitals. And what we have detected by the patients regarding detections, a lot of patients have been delayed in detections. And regarding the patient which received treatments, actually we did prioritize the patients, like what the systems that UK and other Singapore has followed. The patients who actually needs home care managements, like the low risk patients, like patients can have a oral therapy in the case of breast cancer, like hormone treatments, or even the TKIs and others. We treat the patients with that medications. And the patients who are actually very important, which a patient needs treatments, like the patients have a bone involvements, they are having a pains, and even the brain involvements. In that case, that patients of the breast cancer we treat with the radiation therapies and others urgently. And the patients who need actually, we prioritize the patients will have a more benefit with adjuvant treatments, especially in the case of breast cancer, like chemotherapy, which can give benefits, or patient can be cured with the chemotherapies. In that cases, we has given that patients with all type of protections to treat the patients with the chemotherapy managements and others. And regarding the surgery, lot of surgery has been delayed in the COVID periods, actually, because most of the government hospitals has been dedicated for the COVID treatments, and even the physician also dedicated to the COVID units for managing the COVID situations in the country, like the UKs and other countries. So in that cases, there is a delay in especially the routine works of the breast cancer management scenario. This is a small scenarios which I presented regarding the management of the breast cancer in Bangladesh. So Farzana, if you have other questions, I can give answer also.
Thank you so much, sir. Sometimes what happens when you were talking about the treatment and the psychology, sometimes what happens, the female patients from Bangladesh, whenever they want to diagnose the breast or gynae issues, they always consult with the gynecologist first. So detecting, understanding the cancer and its advanced stages, it becomes delayed. So what's your advice for those patients, whenever any patient's diagnosis with a cancer, at first what they should do? Should they see a surgeon first or an oncologist?
In Bangladesh, we had a very good structural setup for diagnosing the cervical cancer, because we had a division. We had a what we call the Upazila Health Complex. In the remote area, we had hospitals, near about 50-bedded hospitals, that can perform the VIA test for the cervical cancer patients, and that also do the breast self-examination test. That is ongoing throughout the Bangladesh. So that can be the patients who are attending the health complex with the 50-bed hospitals near the village. They can have the breast examinations through the physicians. They can attend that centers, and through that we can diagnose the cases in the we can do the early diagnosis. But in that case, we need to set up the mammography and other things. In that case, most of the hospitals have ultrasonography facilities. So we have to aware the patients, especially aware the women regarding the breast self-examination, and if they detect any suspicious in examinations, they can attend the local physicians or local centers. From there, we can also pick up the cases in early stage so that we can cure the patients.
Exactly. Yes, sir. Thank you so much. Sir, I know today is your, you were, attending this webinar from the OPD. So the other doctors will discuss on this topic. By this time, if you can manage time, you can join with us. By this time.
Definitely, I will join. Thank you very much.
Thank you, sir. So now I'd like to hear from Dr. Melanie Seah. As we know, you are the breast surgeon, and the topic you want to discuss on the understanding breast cancer surgery. So over to you, Dr. Melanie. Yes.
Okay, thank you so much, Farzana, as well as the other organizers for making this possible. Thank you for this great privilege of inviting me to speak this evening in your webinar. So I think without much further ado, I'm going to share my screen and going to speak on a topic that's very close to my heart. It's on understanding breast cancer surgery. Okay, so give me a few seconds. All right. Okay, Farzana, are you able to
Yes, please. We can see
the slides clearly? All right, that's fantastic. Okay, I'm going to start the show. Okay, here we go. So understanding breast cancer surgery. Okay, where are we for breast cancer? I think Professor has mentioned earlier, and Farzana as well, that worldwide breast cancer still remains the main cancer for women. It affects 25% of women. In Singapore, this number is slightly higher. It's about almost 30%. And in Singapore, if you live until 80 or 90 years old, your chances of getting breast cancer are about 5%. So it is the most common cancer for women, both in terms of incidence. This means the number of cases that are diagnosed every year. And this is represented by the chart on the left-hand side, where you see the pink-colored pink-colored slice that represents breast cancer. It's also the leading cancer where death is concerned, mortality, and that's the pie chart on the right side. These are Singapore numbers showing that breast cancer is the main cancer affecting women. For the men in Singapore, it's colorectal cancer. So we come to breast cancer surgery, and I'm going to talk about the surgery that we do to the breast, as well as the surgery that we do to the lymph nodes in the underarm area. So used to be when we mention breast cancer surgery, the concept is losing the breast on the site where the cancer is. But fortunately, we know that nowadays it is not always so. It is possible sometimes in some ladies to preserve the breast and to remove just the tumor alone. And that's called a lumpectomy. It's also called a white excision. So as mentioned, a common misconception is to remove the whole breast. But in a lumpectomy, if it's possible, we take out just the tumor and a margin of normal tissue around it. It can be done with the incision immediately over the tumor. It can also be done with incisions that are hidden away, such as one that is around the areola of the breast or underneath the breast. Okay, so I meet many patients, and especially in the more recent years, many ladies that I meet are very keen to conserve their breast instead of losing it. So this is one common question. Dr. Seah, when can I have a lumpectomy? When can I conserve my breast? So there are many factors that we look at in deciding for this. And this slide here shows just a few things that we look at. So to put it very simplistically, if generally the tumor is small, if the lady has a larger volume breast, if there are fewer tumors in the same breast, and if the lady is agreeable to undergo radiotherapy after the surgery is done, then many times it is possible to consider this option. So I explain to patients often that if they are looking at breast conservation surgery, it is a matter of proportion. So when ladies present while the tumor is still small, such as a T1 tumor, which is represented by the tumor size chart on the left. T1 means a tumor that's 2 centimeters or less. So on the right, you can see the comparison. It will be, say, the size of a peanut. So if it's still small like this, many times it is possible to conserve the breast. Whether the lady has a small breast or a large breast, it is still possible. So this is another way of looking at it. The tumor sizes is represented by the picture at the top, and the lady's breast size is represented by the drawings at the bottom. So in a small tumor, T1, size of a peanut, it is okay if the lady has a cup A breast or a larger breast. However, when the tumor gets larger, say if it's the size of a lemon or walnut, if it's 5 cm or so, it is challenging to conserve the breast if she has a smaller volume breast, and this is something that we see quite commonly in Singapore, although it might still be possible to do this surgery in a lady with a larger breast volume. And why is this so? The reason is because when ladies come in with tumors to be removed, when we remove the tumor, we do not just remove the tumor alone. We always aim for the picture on the left-hand side, such that when we remove the breast tissue, we want to have a clear margin. We want to have the tumor right in the middle of the specimen, which is represented by the white-colored lump you see on the picture on the left. And we don't want a situation on the right-hand side where the tumor, which is also in white, reaches all the way to the edge of the specimen, because if that happens, then we are unsure if we have left any tumor behind in the breast. So many times, even though the cancer may look small on the breast imaging, 2 cm, for example, the volume of tissue that's actually taken out is much larger than that. Okay, so oncoplastic breast surgery is a term that has been seen and heard more commonly in the past 10 to 15 years. So what is that? So I will quote this oncoplastic breast surgeon. His name is Douglas Macmillan. I think he practices in the UK. It is any technique used to obtain an acceptable breast appearance while being uncompromising on oncologic effectiveness. So essentially, it means that we still aim to remove all the cancer from the breast, but at the end of the day, achieve a natural appearance of the breast shape. And many of these techniques that we use are basically borrowed from plastic surgery. So it is possible to have to use oncoplastic techniques both in breast conservation and also even in mastectomies. So for breast conservation, what do we do? For larger breasts, many times we borrow breast reduction techniques. This surgery is not too commonly done in Singapore. I'm not sure what the situation is in Bangladesh. However, it's a surgery that's commonly done in the West, where in UK, the average breast size is 34 double D. In UK, 36 double D, and in the US, 34 double D. Many ladies do undergo breast reduction to improve conditions such as backache. So these are some of the techniques that I use. If you look at the picture on the left-hand side, the green color shade and the purple color shade represents the breast tissue that's usually removed when we do a breast reduction. So if the lady happens to have a tumor, which is the blue color dot and the brown color dot, that is in the site of the tissue which will be removed during breast reduction, then it is a very good technique to use because after the surgery, we can both clear the tumor as well as achieve a very natural shape after the operation. And many times, the incisions are such as the ones that you see on the right-hand picture. It can be around the areola, or it can be vertically down or an inverted T. What about for smaller breasts? Again, which is a situation that I find myself encountering very often in Singapore. So our options are more limited. And many times where oncoplastic techniques are concerned, it revolves in a smaller breasted lady. It involves around varying the placement of incision to make it not so noticeable after the surgery. So it can be placed such as the top picture you see where it is horizontal and it skirts around the areola, or the bottom picture where we remove a chunk of tissue that contains the tumor, and after that we close up the gap and then we stitch back the wound, and the wound is essentially around the areola. It's well hidden. And sometimes when there's a large volume of tissue removed, it is possible to replace this volume with tissue from another area of the body. I don't do this surgery frequently, but it can be done. So this picture shows what is done, where the lady has had tissue removed from the upper outer quadrant of the breast on the side, and you can see that there is this ellipse of tissue on the side of the chest wall that is removed and is brought in to fill this volume loss on the breast. Okay, so sometimes the situation can become even more challenging when I have small-breasted ladies, cup A for example, and they are very large tumors, and they're still very keen to conserve the breast. So you can see on the mammogram pictures on the right-hand side, there is this white-colored shadow, and this shadow represents the tumor, and it occupies almost half the volume of the breast. And in such ladies, I would usually see whether or not they are candidates for neoadjuvant chemotherapy. I think Lynette can elaborate a little bit more on that later. And there's also the other option of considering reconstructive surgery. So in a nutshell, what is neoadjuvant chemotherapy? It is only for suitable candidates. Basically, when we give chemotherapy, we aim to kill off cancer cells that have floated to the other parts of the body that are microscopic, many times too small for us to detect. And chemotherapy travels to the entire body to do that. And the bonus when we give chemotherapy is that many times it also works on the primary tumor in the breast to shrink it So there are times 3 to 6 months after giving a lady chemotherapy, the main tumor in the breast has shrunk so much that I can't feel it anymore. Sometimes it at least has shrunk until half the size, and then it might be possible to consider breast conservation in those cases. Okay, another option is then instead of going through this would be to remove all the breast tissue and replace the missing volume with reconstructive surgery. And we do use oncoplastic techniques for this as well. So basically what we do is we remove all the breast tissue, including the tumor, and we try very hard when it's possible to spare the skin. And in some instances, when the tumor is far away from the nipple, we can spare the nipple as well. And we use tissue from another part of the body, or we use implants to replace this missing volume in the reconstruction. And we aim to do this usually in the same surgery. So the lady goes to sleep with the breast still intact, and when she wakes up, the tumor in the breast tissue is gone, and in its place is the reconstructed breast that is either tissue from another part of the body or from an implant. So this is one of the common flaps that we use. Basically, when we use tissue from another part of the body, it's called a flap. It comprises the skin, the fatty layer underneath it, and sometimes the muscle layer as well. So this is called a tram flap. You can see the tissue is taken from the bottom. The tummy area is the same type of tissue that we take when we do a tummy tuck. And the breast tissue has been removed. And basically this tissue from the tummy area, including 3 out of the 6 packs, swung upwards, and it replaces the volume in the breast. So post-surgery, the lady has incision markings over the breast, as well as a long horizontal incision over the abdomen. Another common site of tissue that we take is from the back. So this is a latissimus dorsi flap. We remove tissue from the back as well as the muscle over there and swing it around to the front. And the resultant scar of the donor side, where the tissue is coming from, is like the picture on the right-hand side, where the lady has a horizontal scar over the back. It's quite well hidden. In situations where we can spare the nipple and spare the breast skin, then we try and put the incision in places that are not too obvious, such as underneath the breast, or horizontally or vertically, as you can see from the pictures below. And on the bottom right-hand side, when we close the incision, it looks like an inverted T. Okay, so this picture shows an implant. This is the other option for ladies who want to replace the missing volume but are reluctant to use another part of the body tissue. So I've spoken briefly about the surgery that we do for the breast for breast cancer. So now I'm going to touch about the surgery that we do for the lymph nodes in the underarm area, which we do at the same time when we do breast cancer surgery. So the medical term for the underarm area is called the axilla. And now what is this surgery for? Basically, it's to assess the extent of the cancer spread. Cancer in the breast, when it first spreads, it usually flows to the lymph nodes in the underarm area. So we do a sentinel lymph node biopsy, and basically what I do is, I can show you this. Okay, this shows the lymphatic system in a person, and on the right-hand side, you can see the little round green colored circles. Those are lymph nodes, and it shows the flow of lymphatics of the breast to those areas. So in the surgery, what I do is while the lady is sleeping under general anesthesia, I inject a blue-colored dye around the nipple area, and this dye flows to the armpit lymph nodes, and it stains the first few lymph nodes blue. These are called the sentinel lymph nodes, and I pick these lymph nodes out between 1 to 4 nodes usually. You can see the picture on the right. That's a picture of a node that has been stained blue in color. And I send these nodes for testing. And usually within the hour, the pathologist is able to tell me if the lymph nodes are involved by the cancer. So if there is cancer involved in these nodes, then I proceed to clear all the other lymph nodes in the underarm clean. However, if this lymph node is clear of cancer, then I leave all the other arm lymph nodes alone. So if I have to clear all the other lymph nodes, it's called an axillary clearance, where I remove the lymph nodes from level 1 and level 2. And sometimes there may be a necessity to also remove the lymph nodes at level 3, which is higher up. So in summary, these are my summary slides. So basically, breast cancer surgery involves surgery to the breast, where I've spoken about earlier, and also surgery to the underarm lymph nodes. And where surgery to the breast is concerned, we can do a lumpectomy when it's possible. We can use oncoplastic techniques. The other option is a mastectomy, and that is also an acceptable form of surgery because it does result in lower local regional recurrence rates. And I mentioned the possibility of reconstruction, where we can have a skin-sparing mastectomy if the tumor doesn't involve the skin, and if the tumor is far away, sometimes it's possible to do a nipple-sparing mastectomy as well. And surgery to the underarm lymph nodes, we have the sentinel lymph node biopsy, and if the nodes have been involved with cancer, then I'll proceed to clear all the lymph nodes away. That's an axillary clearance. Okay, so I'm just going to touch on very briefly. I think these slides are actually very important, the next few slides. These are cancer signs and important for all women. I counsel all my patients about this on their routine checks. These are the things to look for in your monthly check that you do. You look for a lump. You look for skin changes, such as any rashes, any discoloration around the skin. You look for thickening of the skin. We call it orange peel skin. You also look for places in the breast skin where it's pulled in, because sometimes when there's a tumor growing behind the breast, it tends to pull all the tissues to itself. So sometimes you can have dimpling of the skin that wasn't there before, and you can accentuate this many times by lifting your arms up. Same thing also happens to the nipple. If you have a tumor behind the nipple, it can pull the nipple inwards. And you also look out for unusual discharge. So any nipple discharge that you have, whether it's fluid or blood, please see your doctor about it. And so when should all these checks be done? In ladies who still have menses coming, you should do it 2 weeks after the first day of your menses. First step is number 3, actually, at the bottom left. You look in the mirror, you look at your breast, look for all the skin changes that I mentioned on the previous slide, look for the inversion of the nipple, look for the thickening, look for visible lumps. If you don't see any of that, that's fantastic. Then you feel for lumps. And you feel for lumps in 2 positions when you're upright. Many ladies do that in the shower because after applying soap, the skin is smooth and slippery and it's easier to feel lumps. Second position is when you're lying down. I think the reason is because when you change positions, your breasts move along with you. And many times, some lumps can only be felt when you're sitting up. Some lumps can be better felt when you're lying down. And I usually tell my patients to check their bras to see whether there's any fluid or blood stains. If there are, do bring it to your doctor's attention. Okay, so thank you very much for listening in. I hand the time back over to Farzana.
Thank you so much. Thank you, doctor. That the whole thing is really informative to our patients, especially being aware before having the cancer. Self-examination is really important. During your discussion, I had a question in my mind is that if any patient is suffering from breast cancer, is it affecting his or her fertility issues for having any baby if this disease is in very young age patient, for the young age patient?
I think generally in
What's your
younger
advice
age
for those
ladies, if
patients?
you are actively undergoing cancer treatment, we would advise holding off family planning for a while until you're done with the cancer treatments. Also because we are worried about cancer recurrence in the first couple of years, especially that's the highest time it tends to come back. And during pregnancy, the thing is the female hormones go up and down, and many times in pregnancy, if some ladies have cancers that are hormone responsive, they tend to grow very rapidly. So if you are a lady undergoing cancer treatment or just recently had breast cancer, we would advise to hold off family planning for a couple of years. And it is possible to look into it after that again. Yeah.
Yes. Okay. Thank you so much. Thank you, doctor. It was really informative. So by this time, if any patients to the audiences, if you have any questions, you can ask our doctors. We will answer all your questions at the end of this session. Before going to Dr. Lynette, because she is going to focus on the breast cancer, I would like to hear from Ms. Ayesha Siddiqua about her cancer journey and establishing that Bangladesh Cancer, Blue Sky Charitable Foundation, a non-profit organization. What is the motive behind this? I'd like to hear from Ayesha, and then I'd like to hear from Dr. Lynette about today's discussion about breast cancer. Dr. Ayesha, Ms. Ayesha, please.
Thank you, Farjana, and all dignitaries who attend the webinar. I am honored and delighted to be part of the to beat breast cancer together. It's a nice topics. First, I am a founder of a foundation, the Charitable Foundation. My inspiration for starting a breast cancer charity in Bangladesh was a personal one. As a breast cancer survivor myself, and as someone who has lost her precious family members, I lost my elder sister Irene Parvin Badhan, who died of breast cancer at 49. I came up with the bright idea to help other women with breast cancer, and we have formed Blue Sky Charitable Foundation with the help of my daughter, sisters, friends, and all well-wishers on 26 May 2016, after my sister's death. My sister died on 2016 at 24th April. I knew how essential it was to have an organization for women in our country who often suffer and more often not perish from breast cancer. I have seen this struggle firsthand as a breast cancer survivor myself when I was diagnosed with breast cancer at a young age on 2011. I'm sure many of you and many people have had a similar experience and are inspired to build an organization like the Blue Sky Charitable Foundation, whose vision is to breast cancer free world and breast cancer free Bangladesh, and its very noble mission of uniting efforts against breast cancer and make awareness among the country and all over the world. And our mission is the common goal is to strive towards a society without breast cancer and its effect. Across borders and cultures, our hopes and aspirations are the same. We hope that there will be groundbreaking medical research that will shatter the myth that cancer has no answer, and that people, regardless their country and socio-economic conditions, will be able to access treatment and cure them breast cancer and from all cancer of all forms. Until then, we know that with the early intervention and diagnosis, it is possible to treat breast cancer that can ensure a higher likelihood of survival and recovery. Yet, in our country, most women are diagnosed with breast cancer in later stages, at stages 3 and stage 4, when the chances of successful treatment and survival become significantly lowered. In these circumstances, I knew how it was vital to have an organization that will stand by women who suffer from breast cancer, women who are breast cancer survivors, and all women and men, as everyone can run the risks of breast cancer. This is why I, along with my daughter, who just inspired me and motivated to help and begin a breast cancer movement, and started the journey of the Blue Sky Charitable Foundation. And since then, we are work for breast cancer awareness and advocacy, educating young women, early detection plan, self breast examination, breast health camp, financial assistance to disadvantaged patients. We have a proposed plan for a specialized hospital, women empowerment through health awareness and protection. And in this regard, we have undertaken many programs, seminars, webinars, and other activities from the very beginning of our journey. Breast cancer health camp was organized. We have a breast cancer health camp from beginning at Dhaka Medical College Hospital, and then we arranged an awareness program in Doctors Care Hospital in Brahmanbaria. We also provided financial help, most probably 100 or 150 women in detection of breast cancer from since 2016 to till date. On January 2018, BSCF arranged a seminar in Dhaka, Dhaka Officers Club, where Dr. Professor Qamruzzaman Chowdhury was the main speaker. We have received significant media coverage in Bangladesh, and we also work with Singapore Rotary, Cancer Care India, and we have lot of programs even now in rural areas. Our program is going on. Also today we have a program in Dinajpur, the breast cancer awareness workshop. The workshop is going on, and our team is always appeared in a talk show. In Corona period, we are helping disadvantaged breast cancer patients in financially, and we are always taking our activities for breast cancer patients, and also make awareness programs to improve the situation. Even though in Corona situations, we are taking our activities, and always we are make this journey. And I think our situation, we can make this situation in our favor. We know, according to our estimate, a lot of people don't know what is breast cancer. Even there is a stigma in our society that that it's a woman issue, and most of the men ignore the issue, and we think the lot we talk about breast cancer. A lot of people will know about the breast cancer, and then the women will aware, and the possibility of breast cancer will remain lowered. And early detection make the treatment easy, and the mortality rate lower. So first, our main focus is making awareness among the women all over the country. Thank you so much.
Thank you so much, Madam Ayesha. Yes, the women like you the corporate officials like you, if becomes inspiration to our generation or to the woman who is working, long time, long hours in the office, they should be careful about or concerned about their breast cancer, breast issues, or always diagnosed with a cancer, earlier detection. All these things needs very much, and this your inspiration will help them to be careful or to be concerned. Okay, so thank you so much, Ms. Ayesha. Now we'd like to hear from Dr. Lynette about her to discuss on her topic today on the advanced treatment options, advanced in breast cancer and treatment options. So, Dr. Lynette, over to you, please.
Thank you, Farzana. Thank you very much. It's a pleasure for me to be here today. And thank you, Ms. Ayesha, for sharing your journey with us. I'll share my screen. Just a second. Oops. Just 1 second. I can't seem to find my.
Take your time.
Yes. Okay.
Yes, we can hear.
So I'll just go through very briefly on what the breast cancer treatment is and what we generally do. And as what Dr. Melanie Seah mentioned earlier, breast cancer is the most common cancer in women all over the world and in Singapore as well. It comprises almost 1/3 of all cancers diagnosed every year, and it's more than 2 times the number 2 ranked cancer, which is colorectal cancer. This is a geographical representation of breast cancer incidence in the countries in Asia. And as you can see in Southeast Asia, Singapore is ranked the number 1 country in terms of breast cancer incidence. The countries that are darker in blue are those with higher breast cancer incidences, and those lighter blue have less breast cancer incidences. So I think Bangladesh is about in the middle. The countries which rank highest in breast cancer incidence in Asia include Japan, South Korea, and the Middle Eastern countries. And the reason for this is because generally these countries tend to have a more westernized sort of diet. They are higher in fat and processed meats, and the women also tend to have fewer children, and they have children at a later age. Incidence of breastfeeding is also less in these countries. This is a graph of breast cancer incidence in Singapore in the past 50 years. As you can see, over the past 50 years, the incidence of breast cancer has been slowly increasing. But thankfully, if you look at the yellow line, the mortality or the death from breast cancer remains flat. It has always been low, and in the past few years has also been declining. And this is thanks to advances in breast cancer treatment over the past few years. So breast cancer treatment can include local treatment, which Dr. Melanie Seah has shared with us, breast cancer surgery and breast radiation therapy, or systemic treatment, which treats cancer in any part of the body, which includes chemotherapy, hormone therapy, targeted therapy, and immunotherapy. So how do we decide which breast cancer treatment to administer? We generally decide by kind of dividing breast cancer into 2, early breast cancer and advanced breast cancer. So early breast cancer generally refers to breast cancer that has not left the breast and the regional lymph nodes. So stages 1, 2, and 3 breast cancer is still considered early, and the goal of treatment is cure. So we will do everything we can to ensure the cancer does not recur. And in general, the general principle is that if breast cancer is operable, we would perform breast cancer surgery, as mentioned by Dr. Melanie Seah, followed by adjuvant therapy, which is treatment given to prevent the breast cancer from recurring again. If the cancer is too large for surgery or if a woman decides that she wants a lumpectomy or to conserve her breast and not go for a total mastectomy, we would administer neoadjuvant systemic therapy, which is chemotherapy that is given to shrink the cancer, and then the patient would go for surgery, and then followed by adjuvant therapy, which is to prevent breast cancer from recurring. Unfortunately, sometimes breast cancer has spread to other parts of the body, and most stage 4 breast cancers are not curable. In the past, we used to have to give a prognosis of less than 6 months to live if a person has been diagnosed with advanced breast cancer. But thankfully, nowadays, with advances in breast cancer treatment, patients are starting to live for many, many years, even with stage 4 breast cancers. So we kind of look at it as more of a chronic illness nowadays, where patients learn to live with their cancers rather than see it as a death sentence. So in the past, we used to treat breast cancers all the same, but nowadays we realize that actually breast cancer is not just one single disease, and it's not a one-size-fits-all kind of treatment. There are breast cancers that have different behaviors and different survivals. So we found that if we look under the microscope and we stain the breast cancers, some of them would stain positive for estrogen receptor and progesterone receptor. So these are female hormone receptors. So these cancers tend to be very sensitive to female hormones. Some cancers would stain for a protein called HER2, and then some cancers do not stain for estrogen receptor, progesterone receptor, or HER2, and we call these triple negative breast cancers. And we find that these breast cancers are all different. So more than 1/2 of all breast cancers are hormone receptor positive breast cancers. So these cancers are very sensitive to the female hormone, estrogen and progesterone. These cancers tend to be more slow growing, but the problem is that sometimes they tend to recur even 5 or 10 years down the road. And then 20% of breast cancers have the protein called HER2. We call these HER2 positive breast cancers. These are the more aggressive types of breast cancers. They tend to recur and they tend to spread to other areas of the body. And then the most aggressive type of breast cancers are the triple negative breast cancers. So 15% of breast cancers are triple negative. And these cancers grow very quickly. But the thing about these breast cancers are that they are very sensitive to chemotherapy, which is the main treatment. So we in the past, we just treated all breast cancers the same, but now we realize that if we know the different subtypes of breast cancer, we should treat them differently because they behave differently. So the estrogen receptor or the hormone receptor positive breast cancers are very sensitive to female hormones. So when estrogen binds to the estrogen receptor, it would cause the cells to grow very quickly and divide very quickly. So obviously the strategy for this sort of breast cancer is to deprive the cancer cells of the estrogen. So one of the treatment would be hormone therapy to reduce hormone stimulation of the cancer cells. And when estrogen binds to the estrogen receptor in the cancer, it would cause the cancer cells to grow. So one of the treatment is tamoxifen. This tamoxifen competitively binds to the estrogen receptor, the ER. It prevents estrogen from binding to that cancer cell, and it prevents the cancers from growing. So this is a possible treatment for hormone receptor positive breast cancers. Sometimes we add on chemotherapy to the breast cancers because hormone therapy alone is not enough. We give chemotherapy if the cancers have a higher risk of relapse, if they are at a higher stage. But how do we decide that? That is very doctor dependent. Some doctors think that this cancer is high risk, some doctors don't. Thankfully, now we have gene tests. So Oncotype DX is one of the gene tests. We take the cancer cells and we run a 21 gene test on these cancer cells. And these genes look at how fast the cancer grows, whether they have a risk of invasion. And this gene test will give us a scoring system. It gives us a recurrence score. So now we have an objective measurement of whether a patient needs chemotherapy or not. So usually for estrogen receptor positive cancers, we would administer hormone therapy. But whether we need to add on chemotherapy, we can run this Oncotype DX gene test, and they will tell us specifically whether there is a benefit to chemotherapy or not. So for example, in this patient who has a recurrence score of 32, there is a more than 15% additional benefit of chemotherapy to the hormone therapy. And then we would then recommend chemotherapy on top of hormone therapy. In advanced breast cancers, in stage 4 breast cancers, our main aim, because they are not curable, is to control the cancer, to keep the cancer under check for a long period of time. So the treatment is still the same for estrogen receptor positive breast cancers. We give hormone therapy, we give chemotherapy, but on top of that, we've developed targeted therapies for these cancers. So one of these targeted therapies are CDK4/6 inhibitors, and there are currently 3 commercially available: palbociclib, ribociclib, and abemaciclib. So these drugs, when we add them to hormone therapy, we found that they can keep cancers under control for much longer. So if a patient with stage 4 breast cancer is given just hormone therapy alone, they could keep the cancer in control for, say, 14 months. But if we add on this targeted therapy, palbociclib, to it, they can keep the cancer under control for 24 months. So a patient cancer would be controlled for 2 years with advanced breast cancer. And one of these drugs, the targeted therapy is called ribociclib, has been shown to improve overall survival for these patients when added to hormone therapy. And what about HER2 positive breast cancers? So these are a different type of breast cancers altogether. We find that these cancers have a lot of HER2 protein that is overexpressed in these cancer cells. And these HER2 proteins cause the cancer cells to grow very, very quickly. So scientists developed targeted therapy against the HER2. So one of these targeted therapies is called Herceptin or trastuzumab. It binds to the HER2, it prevents the HER2's cancer cells from growing very quickly, and it reduces the risk of cancer recurrence. It also shrinks stage 4 breast cancers very significantly. So scientists began to think, okay, if one HER2 drug works well, what about a second HER2 drug? So in the past few years, the second HER2 targeted drug was developed. This is called pertuzumab or Perjeta. It binds onto another area of the HER2 receptor. So when both trastuzumab and pertuzumab is given together, it's been found to significantly control the cancer even more. So even for HER2 positive advanced breast cancers with 2 targeted therapies against HER2, it's been shown that patients can live for up to 56.5 months, almost 6 years, with advanced breast cancers with 2 HER2 targeted therapies. So these are very exciting advances in breast cancer. Another very exciting development of breast cancer treatment for HER2 positive breast cancers is this drug called antibody drug conjugate, where the HER2 targeted drug is bound to the chemotherapy in one single compound. And one of these drugs is called TDM1 or Kadcyla. So the good thing about this is that this drug would seek out the HER2 positive cancer cells, and then the chemotherapy is released into the HER2 positive cancer cells. So the chemotherapy does not go to other normal cancer cells and affect them, other normal cells and affect those cells. Only the cancer cells will get affected by these chemotherapy. So obviously the chemotherapy side effects will be very, very minimal. These patients don't lose hair, they don't have nausea and vomiting like the other types of chemotherapy. So the side effects are very much less. And what about triple negative breast cancers? Unfortunately, for these sorts of breast cancers, because they don't have estrogen receptor, they're not sensitive to female hormones, they don't have HER2 targets, the mainstay of treatment for triple negative breast cancers is chemotherapy. But fortunately, in the recent years, scientists have discovered a way to treat triple negative breast cancers without chemotherapy. They harness the body's immune system. They administer drugs that increase the immune system of the own body to attack the cancer cells. And this led to these 2 individuals being to win the Nobel Prize for cancer treatment, for immunotherapy. So one of these immunotherapy drugs is called atezolizumab. When it's added to chemotherapy, it's been shown to improve overall survival in patients with advanced triple negative breast cancers almost up to 2 years. So even with the most aggressive type of breast cancers that are stage 4, these patients are living much longer. On top of that, it's been found that for triple negative breast cancer patients, 10 to 15% of them do have an inherited gene mutation. So by doing a genetic test and finding that they have an inherited gene mutation, these patients are very sensitive to a targeted drug called PARP inhibitors. So PARP inhibitors for individuals with an inherited gene mutation has been found to be even more effective than chemotherapy alone. So that brings me to the end of my talk. In general, breast cancer is the #1 cancer in women worldwide. And the treatment for breast cancer involves a lot of different disciplines, including breast surgeons like Dr. Melanie, Seah, medical oncologists, and radiation oncologists like Professor Chowdhury. If we know the type of breast cancer and we know the advances in treatment, it will enable us to treat patients with the best treatment. So this is our oncology group, and yeah, my email is over here. Feel free to drop me a line if you have any questions. And this is Farrer Park Hospital. If you would like any further information, please feel free to contact Mr. Hassan.
Thank you so much. Thank you, Dr. Lynette. That was a very informative question, because the patients with advanced breast cancer always think that there is no hope. So the advanced treatment options is there, and yes, there is hope. But still, this session is only for those patients to make them more aware before having cancer. Thank you, Dr. Lynette. By this time, I'd like to hear from you regarding a question that is there any link between gynecologic and breast cancer?
You
Dr.
mean
Lynette, is there any connection between breast cancer and gynecologic cancer?
okay.
Cancer.
In certain patients have inherited gene mutation, as I mentioned. So one of those inherited gene mutations are BRCA gene mutation. So individuals who have BRCA gene mutation, they have an inability to repair mutations that occur in their own body. And because of that, they have a higher risk of having cancers. And the cancers that these individuals tend to be at high risk include breast cancer and gynae cancers. So if a person has an inherited gene mutation, then they would have increased risk of both breast and gynae cancers at the same time.
I see. Okay, so we have a few questions from the audiences. If Dr. Qamruzzaman sir can join us. So I think you already. Okay, so he had a question. What are the common female cancers in Bangladesh? And are there any different types of breast and cervical cancer?
Yeah, the common female cancer in Bangladesh, according to the National Cancer Institute database, and also the different hospital raised in Bangladesh, it shows the cervical cancer is the most common in Bangladesh and breast cancer is the second most common in Bangladesh. And what are the initial symptoms of breast cancer, cervical cancer? Because in the case of breast cancer, the patient may come with a small lump, a small mass or lump in the breast. Cervical cancer, sometimes patient comes with a bleeding, and sometimes if the patient advances, comes with different symptoms, because it will depend upon the stage of the disease. If the patient has a higher disease, patient comes with a chest wall fixation, pain, and other things of breast cancer. Cervical cancer is also that patient may come with a pain if there's a pelvic involvement and other things. So it depends upon the stage of the disease, actually.
Okay. Let us get more questions. Okay. So another question is from Ms. Konika. Is there a link between hormone replacement therapy and breast cancer? So this is, I think, to Dr. Lynette.
Okay. Unfortunately, there is, especially if the hormone replacement therapy is administered after menopause. It also depends on the duration that the hormone replacement therapy is administered and the type of hormone replacement therapy that is given. There are the dual hormone therapies, and there's just a single estrogen type of hormone therapy. However, in general, there have been many studies, I think the Million Women study and a few other that looked at multiple women on hormone replacement therapies, and there has been shown to be a link with hormone replacement and breast cancer. That's because, like we mentioned, more than 60% of breast cancers are hormone receptor positive. So they are very much stimulated by hormone. And if hormone is taken for long periods of time, then this can potentially be a stimulus for breast cancer.
Okay. Doctor, this is, I think, for Dr. Seah. That is, what are the potential side effects of breast cancer surgery? This is by Ms. Monica.
Potential side effects of breast cancer surgery. Okay. Breast cancer surgery is usually quite well tolerated. It's not a very large surgery. I think only reconstructions are considered major. Most of the time, my patients will stay overnight and be home in the next day. So when I counsel my patients for, say, surgical risks, it's not very high. Usually, we just talk about small risk of bleeding or infection, maybe a small risk of the underarm becoming numb, especially in the area where we harvest the lymph nodes from. And also a small risk of arm swelling. We call that lymphedema due to the delay in lymphatic flow back to the body. So those are the common breast cancer surgery risks that we find. Side effects after the surgery, by and large, not many. Actually, most women recover really fast and recover quite well. They usually go home with a couple of drains, especially if they've had a mastectomy or reconstruction done, and those drains usually come out by about 2 weeks after surgery. Yeah.
Yes. Yeah, definitely. And early detection helps, and the surgery, if the surgery can be done earlier, I think the spread, cancer doesn't spread that way. I mean, the advanced stages can be controlled. So, and we are very last of this session, end of this session. I would like to sum up this session with the advisors from each of you. I'd like to, here start from Dr. Melanie, and then Dr. Qamruzzaman with the advisors. Last few words for our audiences who is watching you now. Dr. Melanie first.
Okay, thank you so much. I think I would just like to remind all the ladies to be breast aware. Please run through your breast self-examination every month. It is very important. And go for breast screening as and when you can, because I think early detection is key in breast cancer. It gives very good results when you can come in earlier when the disease is still early.
Thank you. Dr. Qamruzzaman, sir.
Yeah, that should be actually every woman should have his best examinations of what Dr. Melanie has told, and we should go for screening to detect the early disease so that every patient can be cured. And definitely because our patients are coming in advanced stages, so we need to diagnose the disease in early stages. And also they should avoid some things, especially the risk factors for the breast cancer, especially. They should have a very good exercise, healthy diets. That is a very important for breast cancer, especially risk factors, especially. So early diagnosis and especially what we need actually, we should go through in every month, especially about the breast cancer awareness. We should talk about the awareness, and every patients and every person should talk about the awareness of the breast cancer, so we can detect the patient in early stages, so we can make the patient curable. Okay, thank you.
Thank you. Ms. Ayesha, as a corporate woman, what's your advisor's last few words?
Thank you, Farjana. I think
we can hear you.
Can you hear me?
Yes, we can hear you.
Thank you. As we know, the last month was breast cancer awareness month, and I think government will declare October as a breast cancer awareness month. And in Bangladesh, we have to celebrate World Breast Cancer Day, and we have the option to free mammogram and screening, and also medical coverage like insurance coverage and everything. And we have to make more awareness program. so that
Yes.
women will know about breast cancer, and they can take care of them, and they can also aware of their breast health. And I think breast health is is a part of human rights. So
Thank you.
with
Yes.
the awareness, and women can be empowered also. Thank you so much.
Thank you so much, Dr. Lynette. We'll finish with your words.
Yeah, I think everybody has said it all. I agree with the other three speakers. Early detection saves lives. So please go for your mammogram at age 40 every year to pick up cancers at the very early stage when it's completely curable. And if, unfortunately, if cancer is diagnosed at the late stage, there's still hope. Don't give up. I mean, there are plenty of advances in breast cancer treatment where patients can live for many, many, many years. And also, what Dr. Chowdhury said, healthy lifestyle is very important. Don't smoke. Try not to drink alcohol, and a low-fat, healthy diet is very important.
Thank you, everyone. I'd like to thank Blue Sky Charitable Foundation for joining with us. I'd like to thank all our participants for giving us time. And this was really interactive and informative session. Our audiences, if you have any questions, queries to Fairpark Hospital, to our doctors, to Dr. Qamruzzaman sir, or any help from Blue Sky Charitable Foundation, please knock through our Facebook page, and I am IC. We are always here to help you. Thank you, everyone. This is the end session. Thank you.
Thank you.
Thank you.